Hello everyone, this is Anusha Chimkala. In this video, now I will be discussing about asthma and the symptoms, causes and the pathophysiology of the asthma and the drugs used in the treatment of asthma. So let's continue. So starting with the definition of asthma, what is asthma? It is a chronic condition in which the airways get inflamed, swell and produce extra mucus which makes a person difficult in breathing. Okay. So the symptoms include shortness of breath, chest pain, coughing or wheezing, and trouble while sleeping. So what are the causes of asthma? The main cause would be tobacco smoking, air pollution and allergens to pollen or dust mites. These are the causes of the asthma. So how tobacco smoking causes asthma is when a person inhales a tobacco smoke, the irritant substance when they inhale, so that substance occupy on the lining of the airways and makes them swell, inflamed and produce extra mucus. It makes a person to breathing difficulty. So what is asthma? Here the meaning of the asthma is difficulty in breathing. This is one of the chronic inflammatory disorder, okay? And the symptoms and the causes include, the symptoms are shortness of breath, chest pain, coughing, trouble sleeping due to the coughing, wheezing and shortness of breath. And the causes would include air pollution, infections like cold, flu and allergens such as pollen, dust mites and tobacco smoke. So what are the structures that are getting inflamed in asthma is mainly the airwaves. So for the inflammation of this particular airwaves, there are certain cells which causes this inflammation, that are mast cells, eosinophils and T lymphocytes. So these cells release the inflammatory mediators, and inflammatory mediators which are released by these cells cause the inflammation of the airwaves. Okay. Now you take this particular bronchial asthma. It is a type 1 hypersensitive reaction. So there are 4 types of hypersensitivity reactions. So bronchial asthma is type 1 hypersensitivity reaction. So what exactly you mean by type 1 hypersensitivity reaction is, the type 1 hypersensitivity reaction, it is characterized by the formation of the IgE antibodies. This, whichever formed, the antibodies whichever formed will cause the release of the histamine and leukotrienes which are released from the mast cells. These cells are responsible for the inflammatory process. So this is what exactly happens in the type 1 hypersensitivity reaction. Okay. So coming to the histamines and leukotrienes whichever formed from the mast cells causes the bronchoconstriction. It not only causes the bronchoconstriction as well as it causes the inflammation of the airwaves, okay, which lead to the hyperreactivity. So for the bronchoconstriction we use bronchodilators, and for the inflammation of the airways we use anti-inflammatory drugs. So coming to the bronchodilators, we have sympathetic amines drugs and parasympathetic drugs and methylxanthines. These 3 group of drugs causes the bronchodilation. Okay. So coming to the hyperreactivity, the mast cells which bond with the IgE antibodies causes the degranulation, which produces the histamines and leukotrienes, which causes the bronchoconstriction, which leads to the inflammation of the airwaves. Okay. So coming to the anti-inflammatory drugs, we have anti-Ig drugs, that is omalizumab, and we have mast cell stabilizers, that is sodium chromoglycate, and the drugs that decrease the release of inflammatory mediators, we have corticosteroids and xylitol. And the drugs that inhibit the activity of the inflammatory mediators, we have zafirlukast and montelukast. Okay. So this IgE antibody binds to the mast cell, which causes the degranulation. Then the inflammatory mediators are released. This causes the hyperreactivity of the airways. Okay.